Hey everybody, I am going to give you guys just a couple seconds to kind of log in and we are live today. And today we are going to be talking about all about diagnoses. And we are live today. Hold on one second. Today we all right, everybody. So give me 1 second. Sorry about that. All right. Everybody, today we're going to be talking about all about diagnoses. How many of you out there are searching for a diagnosis still with your autoimmunity? How many of you wondering why it's so dang hard to get a diagnosis? And many of you are asking the question is, well, if I don't have a diagnosis, what next? Okay, so today it's going to be all about diagnoses. Hey everybody, Maggie Yu MD here, functional and holistic medicine physician and owner of Transform Autoimmune. And if you haven't joined our Facebook group yet, I'd love for you to check out our Facebook group called Transform Autoimmune Disease Naturally. Currently, at the time of this, we have 37,000 members. And in our Facebook group, we literally have truck full, hundreds and hundreds of videos and guides on how to deal with any autoimmune related issue. And even hormonal issues as well. So if you haven't joined the group, make sure you join the Facebook group, Transform Autoimmune Disease Naturally. If you are watching this on YouTube right now, I'd love for you to give me a thumbs up and also click the button to subscribe. And all of you in the comment section right now, I would love if you could actually just let me know where you're watching from in the comment section. I'd love to hear from you. YouTube, you're watching. I'd love for you to comment. Tell me where you're watching from and what autoimmune struggles you've been dealing with. That would be great. And any of you that are already in our Facebook group, or you've already watched some of my previous videos and have commented before, make sure you actually check your Facebook Messenger under message requests, because oftentimes our team would have already dropped you some resources or Easter eggs for you to actually already get started in turning around your autoimmunity. All right, that being said, before we dive right in, I just want to see who is watching. Lisa is watching. Thank you for watching, Lisa. And if you're an alumni, if you could write in the comment that you're an alumni, that'd be great. And if you're an alumni and what autoimmune struggles you've overcome already would be even better if you could write there. Gina, great to see you. Alumni right there, thank you. And Lisa already says, no diagnosis, don't know what to do. Okay, Denise is watching from New York. Lisa says, I've been stalking her for over a year now. Thank you for stalking. Thank you for your participation. Amanda says, Lindsay, here it is. So those of you that know somebody that could benefit from watching this video immediately right now, put their name in the comment section, because sharing is caring. They may not want to hear it from you, but they may want to hear it from me, or they may learn something from me. So if you can help them by putting their name in the comment section below, that would be awesome. Okay. Cam's watching from Wisconsin. Thank you so much. Monica's alumni with Hashimotos who's watching. Kathy, alumni. Oh my gosh, Kathy, I haven't seen you in ages. Great to see you, Kathy. Awesome. And then, all right, everybody. So thank you for watching. Today we have a big topic, and this has been going on in the Facebook group. We posted a question about this, and there's been constantly people that are questioning, what is my diagnosis? What do I do if I can't find a diagnosis? Or what if I have tons of mystery symptoms and I don't know what to do with it because I haven't officially been diagnosed? And so I think that today we're going to actually bust some myths around diagnoses and also educate you guys about diagnoses as well. How important is it? How frustrating it is? What to do about it? We're going to go all into that. So I have some top questions that people already have been asking in the Facebook group, and I am going to start with question number one. Question number one is, why is a dang diagnosis so hard when I'm struggling with what I already know possibly is an autoimmune disease, right? Let's say you don't have a diagnosis and you're in that warehouse feel of like going doctor to doctor, specialist to specialist, getting testing done. You got a shit ton of symptoms. And why is it so dang hard to come up with a diagnosis? How many of you are in that boat? And if you are, put in the comment section that you're in the boat of still searching for a diagnosis. So I'm going to answer the question right now, which is, why is it so difficult? I think that inherently there's a couple things here, which is that I want you guys to understand the scientific basis of autoimmune disease, which is that in autoimmune disease, what it is that your immune system in your body is normally supposed to recognize germs that are outside your body and say, you're a germ and I'm going to kill you if they come in to invade, right? Or it can do that even with cancer cells and says, you're a cancer cell, I'm going to kill you, right? The problem is in autoimmunity is your own immune system is starting to look at parts of your own body and says, you're a germ like yourself, and I'm going to kill you. And so it's mistaking a part of your own body as a germ, and it's starting to attack it like crazy. Now, here's an issue, everybody. So let's just use the thyroid as an example. Some of you heard me say this, right? And your thyroid, let's say, has right now, okay, there's a couple blood tests to diagnose autoimmune disease of the thyroid. So this is a quiz. Some of you who've seen my videos already, some of you who are in my programs right now already are alumni. Just in the thyroid alone, do you know how many possible targets there could be for an autoimmune attack? How many different targets? Just a tiny little gland on your neck, that one gland alone has over 6,000 targets of autoimmune attack. 6,000 different targets of autoimmune attack. Do we have 6,000 blood tests to diagnose every autoimmune disease of the thyroid? And the answer is hell no. In fact, we only have 3. 3, just 3. So if you only have 3 of those targets that have been identified, and we only have blood tests for those 3 targets, are there people walking around with autoimmune disease of one component of the thyroid or multiple that are in the other 5,997 other category that will never get diagnosed by a blood test? This is not a trick question. This is a really real dilemma, which is just in the thyroid alone, less than like 0.5% of autoimmune targets can be diagnosed with the blood tests. And that's just one example of thyroid. You know, what if you just have random joint pain? Is rheumatoid arthritis the only diagnosis there possibly could be? Is the test for rheumatoid arthritis? There's a couple tests for rheumatoid arthritis. Are those the only targets that could be attacked in a joint? And the answer is hell no. There's thousands of possible targets just in a joint symptom alone that could be a target of autoimmune attack, but the number of blood tests that we have currently available to diagnose that problem is literally like 1 or 2%. So the problem is that we are there. It really is. There's technology is lacking to be widely commercially available to have every single target of autoimmune disease to be easily diagnosable with a blood test. So this is why I can already tell you alone right now how many people are walking around joint pain that are testing negative for all the tests for rheumatoid arthritis or psoriatic arthritis, some of the top hitters, and they're told you don't have a diagnosis, but you know you still have joint pain. And you already know that you have a ton of other symptoms and you already suspect that there's something autoimmune going on. And the truth of the matter is most of us with joint pain or most of us with any autoimmune disease currently there's no blood test to even diagnose it. Okay. So that is a problem. Okay. That's a big problem. And that's why a diagnosis can be really difficult because we really only have, in my estimation, probably like 3 to 4% of autoimmune diseases really do currently have a blood test. And there's probably 97% that we don't even have a blood test to be able to diagnose. So that doesn't mean that it's all in your head, right? And that also means that you will be going from specialist to specialist and getting test after test after test, and it will test negative. And that doesn't mean you don't have an autoimmune disease. So why it's so hard to get a diagnosis is because the technology and the number of blood tests just simply don't exist to be able to diagnose every autoimmune illness. And the other thing too is that do we even want to run 6,000 tests on thyroid alone to figure out if you have an autoimmune disease or not of the thyroid? And the answer is it's also practically not possible to, even if we had a technology for 6,000 tests for the thyroid alone, can we run 6,000 blood tests on each person that we suspect of having a thyroid disorder? And the answer is also no. So that's why there's going to be a problem with diagnosis, because the technology just isn't there. And then the sheer number of possible target of attacks is so high that it makes it really impossible sometimes to diagnose specifically which one of the 6,000 targets of autoimmune disease of the thyroid or autoimmune disease of the joint do you have. It's sometimes really difficult to do that. Is this does this resonate with anybody? I mean, and is this like an aha moment for you? Is it a light bulb moment? If so, comment in the comment section below. I'm going to just take a quick look at the feed here on YouTube and on Facebook and see if there's any questions just around this point, which is, why is it so hard to diagnose autoimmune diseases? So Lisa says, Dr. always tells me is in my head, I've given up. And you could see that, right? Cam is saying that she's still searching for a diagnosis. Leslie is saying that she has dilated cardiomyopathy, broken heart syndrome, cognitive impairment. Jennifer is saying she's struggling with Hashis and Sjogren's, which is probably going to bring up another point here for me right now, which is that one of the things is that the second piece of this is that, yes, that's one of the reasons why it's so hard to diagnose, is because there's just so many different targets of autoimmune attack. But this brings up a second point to me already, which is, what if you already have an autoimmune disease? You already know you have one diagnosis, okay? And yet you have all these mystery symptoms that none of your doctors can explain, and they're stumped. Therefore, you're feeling like you're being told it's all in your head, or you're going through the specialist shuffle. How many are you in the specialist shuffle? So an example of this would be, let's say Trinity just said fibromyalgia, almost also being checked for RA and lupus, okay? So this brings up a lot of different issues, okay? So let's use an example where someone already has a diagnosis of rheumatoid arthritis, RA. But then why are their fingers going numb? That's neuropathy, okay? Why do they have irritable bowel syndrome? Why do they have constipation and diarrhea, right? So that's irritable bowel syndrome. Why do they have chronic fatigue, right? So you may have already a known diagnosis, but then you're in a diagnosis search for how many other diagnoses could there be? And how many of you are in that boat where you have a known diagnosis, but you have 5, 10, 20, 60 other mystery symptoms that is stumping your specialists? Go ahead and type into the comment section right now if that applies to you. And I'm going to tell you right now that you currently may think you're the biggest zebra on the planet because of this issue. And I'm going to tell you, no, you're not. Okay. This is the most common scenario I have seen in every autoimmune disease on the planet. Okay. Let's talk that through. All right. Let's talk that through. Because the thing is that I already mentioned before, this is basically our second question, which is like, why do I have so many other mystery symptoms? And why am I still searching for more and more diagnosis? Well, one of the things I've already talked about is that when you have an autoimmune disease, your body is mistaking a part of your body as a germ, right? So let's say it already mistakes one part of your body as a germ. Let's say connective tissue, okay? And connective tissue can be also in multiple parts of your body. It isn't just in your skin, it's in your esophagus, it could be in your eyeball. So that one target alone can be present in multiple areas all over your body, which is why, you may have one diagnosis. I have a connective tissue disorder that affects my esophagus, let's say, but then you can have skin rashes. Okay. Or you may have vision problems, or you may have breathing problems with your lungs because there's connective tissue in all those areas. So that one target may be present in multiple areas. The other thing too is that many cells look the same. So let's say you have Hashimotos where you have autoimmune attacking your cells or your thyroid. Well, that's a hormone making cell, right? So hormone making cells aren't just thyroid cells. You may have hormone making cells in your adrenals, in your ovaries, in your pancreas, in your brain. So look at this example. Can someone with Hashimoto's, which technically should just have low thyroid, right? Can they have problem with being a diabetic or pre-diabetic or their blood sugar because their pancreas cells are being attacked also? And how many of you with Hashimotos have blood sugar problems? Or how many of you with Hashimotos is already a diabetic or a pre-diabetic? Me. Okay. And they're going to tell you it's not connected. And the answer is hell yes, they're connected. And you're right. And how many of you with Hashimoto's have thyroid problems, have crazy ass hormone problems with your ovarian hormones, with fertility issues, period issues, PMS issues, right? And now you're cuckoo because it's all in your head. Well, you're not, because ovary cells look almost identical to your thyroid cell. So, of course, everybody with Hashimoto's is a hormonal shit show with all the hormones, other hormonal organs under attack. And therefore, all these Hashimoto's are called crazy women or crazy men with all these hormonal symptoms that's in their head. When the reality, and this is a big problem with how we train physicians, is they don't understand that the fact is that cells look very similar to other types of cells, and that when your body's already mistaking one type of your cell in the body as a germ, the likelihood it's going to mistake many different other body parts as a germ because there's some similarities in how the cells look is 100%. So nobody with one autoimmune disease just has one target of autoimmune attack. Everyone with any autoimmune disease is going to have hundreds, if not thousands, of other cells that are mistaken identity-wise will also be under attack. So the typical autoimmune patient is someone that, not even if you have a diagnosis of RA, Hashimoto's, Crohn's, will have a shit ton of other mystery symptoms that will stump your specialist, because they have no idea about what I'm telling you right now, which is this mistaken identity is happening all over the body. And so you're going to have tons of other autoimmune attack targets. And what we do in the conventional system is medical system is play whack-a-mole. We're going to say, oh, you have Crohn's and you got brain fog. Let's send you to the neurologist for a battery of testing. Oh, you've got Crohn's, but now you have joint pain. Let's send you to the rheumatologist to do some blood work to see if you have rheumatoid arthritis or psoriasis. Oh, those are negative. Now that's in your head. So how many of you is this resonating with? Because to me, the biggest problem here is a lack of training of our medical doctors in this whole idea of mistaken identity syndrome and autoimmunity, which means that your body is making many mistakes in identifying what's friend or foe. So it's in identifying a lot of different body parts as that is usually a friend, and it's identifying as a foe. So you're going to get tons of symptoms all over the place, which is why we get into this diagnosis hell and specialist conundrum all over the place. Does this make sense? Okay, what I'm going to do is I'm going to jump in the comment section and see if we have any questions around this whole idea of why, even when you have one diagnosis and you already have one, why you have so many other mystery symptoms and why you end up going all over the place searching for more and more diagnosis. Why everybody with autoimmune disease falls into this trap, and so do your specialists, and why this search becomes fruitless almost all the time. And it's a circle. So I'm going to take a look at symptoms. Cam says so many symptoms and positive ANA, high SED rate, plus other markers. Correct. You have some markers and yet so many mystery symptoms that can't be explained, and you may never get a diagnosis. And I just explained why. Cam says, could a connective tissue diagnosis in the esophagus present like reflux symptoms? Of course, it can represent as other symptoms as well, right? Another Facebook user says, I have a skin rash and recently been getting shortness of breath, lung stuff, right, going on, right? Low blood sugar episodes. Look at this one user saying, I have skin rash, I have shortness of breath, and I have low blood sugar. Oh my gosh, you're cray-cray. You need to go see 6 specialists and get 6,000 different tests and then be told that they're normal and you're fine and it's all in your head. How many of you find that happening to you and think you're some super special zebra because of it, right? And this is literally actually the typical autoimmune patient, okay? How do I know? Because I've been dealing with this those of you that do know me, I've been in practice as a physician for 24 years, the first 10 years as a family medicine physician, and the last 14 years as a functional medicine physician, focusing on autoimmunity, hormonal health. Why? Because those were my problems. I had to learn all that to save my own life, right? So until I got sick, I didn't realize that we were so limited in how conventional doctors deal with this. And we were actually creating a whole diagnosis hell for a lot of patients. I went through all that, right? But now at the other end, 14 years later, functional medicine years later, and having an online program and working with thousands of people on autoimmunity, I see patterns that regular doctors are missing all the freaking time, right? So I hope that this has been helpful. And Lisa says, my doctors won't even refer me out anymore, told me to make a gratitude list and see a psychologist. How many of you have been told that? Lisa says, my inflammation is normal, but pain in my feet, jaw, throat, everywhere. Okay, right? Kelly says, Hashimotos, constant shortness of breath. Don't know if it's anxiety or symptoms of Hashimotos. So this is a really classic scenario, and you guys are just verifying it, right? And on YouTube, Paula is saying that she just recently started some hormone supplements to help with the hormones. And yet I'm telling you, anybody who's watching on YouTube, I bet you, like, even if you have hormonal symptoms and you try to deal with it, what about the joint pain? What about the constipation or diarrhea, right? There's so many symptoms that you're dealing with. And instead of thinking of yourself as a special zebra, this is the typical symptom of any autoimmune disease. This is the typical scenario. You're not some super special zebra. So what can you do about this when either you don't know what your diagnosis is, or you already have a diagnosis and you're still searching for multiple other diagnoses? How do you break out of this? For me, I think this is going to be probably blasphemy to some people, all of you that are really attached to looking for a diagnosis. In a lot of ways, for me, a diagnosis doesn't even matter. I'm going to repeat that. A diagnosis doesn't even matter because I look at this, I look at something and I say, hey, if you have 5, 6, 10 mystery symptoms and you've already gone down that route and nobody's giving you an answer because they're not able to, there is something going on that's a chronic, either inflammatory condition or an autoimmune condition that's attacking different targets in your body that somebody can't diagnose. You already know this. This is what I call the mystery disease syndrome or autoimmune syndrome or an inflammatory disease syndrome, okay? We already know you've got a systemic, like a whole body issue going on that's inflammation-based, that's autoimmune-based, right? That's already a given. We already know that. Who cares what the name is? What I care is, how do you stop it? What are some things that you can do to stop this? Number one is recognition that you have some sort of systemic inflammatory or autoimmune illness that's attacking several targets or multiple targets. Once you have that, you can actually move on. And the reason you can move on is the question is no longer what's the diagnosis, right? And you can keep searching for a diagnosis, that's fine, but that doesn't give you a solution, because the most important question isn't what's the diagnosis, it's how do I stop this crap? How can I stop this attack on all these different targets? And that's where the big focus is power thing. And I'm going to say, when you can make the mindset shift from what's my diagnosis or what am I naming these diagnoses, when you can shift from that to what I call solutions, what is the solution? Okay. That's a totally different ball of wax. And that's the only way with which you're going to be able to stop this shit. Really. I'm seeing people like Kelly saying yes. Lisa says, please stop this from happening. Another Facebook user says, my doctor told me I'm insanely healthy. Bullshit. Okay. Despite the fact that I have IBS, psoriasis, and insomnia. Your doctor says you're insanely healthy because he or she can't diagnose all the hundreds or thousands of targets that are actually under attack. So then what? If they don't have a test to diagnose it, you're insanely healthy or you're cray-cray. Only medical conclusion, and I call bullshit to that, and I'm going to say I'm the opposite of that, which is, come on, we already know you have an inflammatory process. We already know you have an autoimmune process. So what's the solution? Okay, so that's a mindset shift, moving from stop asking what the diagnosis and stop searching for it, and really focus is power on what is the solution. So I'm going to focus the next question. Then it's going to be, people are going to be like, okay, I already know I got one autoimmune disease and multiple symptoms, or I don't have a diagnosis. And I now have made the mindset shift that I have some sort of systemic autoimmune or inflammatory illness, What do I do? What are the action steps that I can take right now? So what I'm going to tell you is that the conventional approach to chronic systemic autoimmune or inflammatory illness is god awful. Okay? That's another awareness right there, which is that the only way that regular doctors are trained, and I know because I was a family practitioner first 10 years, right? I'm an MD who got sick. So the only way that conventional doctors know how to deal with multiple symptoms all over your body without a diagnosis is a medication or procedure for every different one of those symptoms. So then you get into medication or procedure hell. Okay? Medication procedure hell. Oh, you got hormone problems. Let's remove your uterus. Oh, you got thyroid problems. Let's go ahead and remove part of your thyroid that has the nodule. Oh, you got this hip joint problem. Let's do a hip replacement. So the problem is that you're going to get the solution is not going to lay in the conventional approach because that's going to be band-aiding, whack-a-moling every single symptom. And this is where you end up with 20, 30 meds, 20, 30 different specialists, and nobody's talking to each other. And you're getting worse and worse because these medications themselves can have side effects, or they don't work, or they interact with each other. That's like a whole set of hell, right? So there's many problems with the conventional approach to someone with multiple symptoms that are without a diagnosis. And I already just told you why that's problematic. So forget about a conventional approach, meaning like if part of that's working for you, keep it. But the parts that for you that aren't working, I really am going to tell you the answer is in a functional medicine root cause approach. Okay. And I can tell you right now, what is a functional medicine root cause approach? I'm going to go ahead and just pause for a second and tell you guys if you are if hold on one second. Yeah, what is a root cause functional medicine approach? And I'm just going to pause for a second. If you haven't joined our Facebook group, go ahead and join our Facebook group, Transform Autoimmune Disease Naturally, because in the Facebook group, I have literally hundreds of videos on what is a functional approach to autoimmunity or any inflammatory or autoimmune mystery illness. On YouTube, check out YouTube because I have hundreds of videos there as well. Follow me on Instagram because I'm constantly posting content about this very issue. Okay, so let's talk about what is a root cause to functional medicine approach. What I can tell you is this: is that when we talk about that in my program, there is the 5 pillars approach. Every single one of these pillars really is what is the root cause of any inflammatory or autoimmune disorder or any mystery illness disorder. I don't even care if you have a diagnosis or not. I don't even care what the diagnosis is. It doesn't matter because these 5 pillars solves every one of these issues because that is the root causes is right there is the 5 pillars. That being said, a lot of people are like, oh, I don't have autoimmune disease. I don't need to join your Facebook group. I don't think, will this work for me? Because I have fibromyalgia, I have chronic fatigue syndrome, I have IBS, I have PANDAS. Will this work for me? And I'm going to tell you is that it doesn't matter. If you got symptoms all over the place, you can benefit from an inflammatory or autoimmune approach. That's a root cause approach. And I'm going to tell you this also, and it's probably going to be blasphemy, which is I know that the name of the Facebook group is Transform Autoimmune Disease Naturally, and the program is Transform Autoimmune. But I can tell you that I could have easily rebranded this program into 10 different programs to say transform fibromyalgia naturally, transform autism naturally, transform ADHD naturally, transform IBS naturally, transform cardiovascular disease naturally, transform Parkinson's naturally, because these 5 pillars are actually the fundamentals of a functional approach to any chronic disease. Okay. So if you want to know exactly what those 5 pillars are, I'm not going to go through all that in this training because it's not the scope. Can you type in the comments 5 pillars? Just write 5 pillars. And once you comment 5 pillars, someone from my team is going to send you a message. Check your Facebook Messenger request area. Otherwise, you won't see it. Later on today or tomorrow, check your message request box, and we would be sending you the resource to our 5 pillars training. So comment 5 pillars, and that 5 pillars training has all the details on exactly the 5 areas that's the underlying root cause of any inflammatory or autoimmune disease or mystery illness. So to me, that is the solution is you got to think way beyond conventional medicine and say, how can I stop the causes that's causing all these targets to be under attack? And the answer is actually not difficult. It's actually simple when you actually go through the 5 pillars. Doesn't mean it's easy, but it is simple because there really are 5 main areas. And when you watch the 5 pillars training that I do, it's very detailed. I go through exactly what the 5 pillars are and what the testing is on the 5 pillars and what are some of the major ways to actually deal with each of those 5 pillars. So thank you everybody in the comment section for the 5 pillars, and make sure to check your messenger request for that. And YouTube as well. If anybody who's watching on YouTube right now, just write 5 pillars in the comment section, and a member from our team will be replying to your comment with resources about our 5 pillars. All right. So, all right. So I want to actually throw in a bonus section. I know this has gone on for a long time. And if you have any questions, feel free to actually post it in the in the comment section below. I actually would love, if you're an alumni and you're actually watching this, I would love for you to comment in the comment section is that, really maybe the one main thing in one pillar, if you can name one. If you're an alumni, can you name the one pillar that impacted your autoimmune disease the most? That was like a major shocker and game changer. If you could type it into the comment section just to share your experience with other people on what autoimmune diagnosis you have and what was the one pillar that was like game changer for you. That's just 1 out of 5. Would be great in the comment section just to show people like what some of the real hundreds of people that have been through our online program have actually experienced. Share your real experience. So alumni, if you would do that, I would really appreciate that. Diane, thank you. Diane says, Dr. Maggie's the bomb to stopping your autoimmune. Alumni. Thank you, Diane, for that comment. And Diane, and if you haven't watched Diane's interview, Diane actually has RA, and she has been on some of our interviews about her pain. She had actual nodules with all over her hands from rheumatoid arthritis, preventing her from sewing and many different types of activities. And within weeks, her nodules were starting to go away. And she's doing cartwheels now. I think there's actually a photo of Diane doing cartwheels on the beach with her hands on the ground just weeks after joining our program. So conventional medicine would say it's impossible for these nodules to go away or for a pain level of 10 to go to like 1 over just a couple weeks. And conventional wisdom in conventional medicine, that's true. It is a miracle in their book because they have never seen a root cause approach, because they're just giving this medication, that medication, that medication, and that medication. So I'm really advocating for the importance of a root cause approach, and the results are astounding. Astounding. I'm not talking mini like fairy dust here. I'm talking people going from 8 out of 10 pain to like 1 or 2 out of 10 pain in a matter of weeks or over just a couple months of working with us in our online program. So real people, real results. So Diane, thank you for commenting. All right. So I have a bonus question here. I'm not seeing a whole lot of additional questions. So I have a bonus question that I was going to talk about, which is, what are some common mystery illnesses, or what are some common illnesses or chronic disease that no one really realized could benefit from a 5 pillars root cause approach, or that's going to be later diagnosed as being autoimmune? So this is going to be important. Listen up, people, because some of this is going to shock you, and none of this your doctors know. And this is from my years of experience. And so I'm just going to tell you, the way I figured this out, honestly, was, when I had a private practice in Oregon, I gathered a lot of I had literally thousands of autoimmune patients in the state of Oregon was in my clinic, my integrated functional medicine clinic. And at the time, and what happened was a lot of these autoimmune people were getting better and better, but they would like bring me their kids. So guess what happened? I amassed one of the largest spectrum disorder clinics with kids with spectrum, autism spectrum, ADHD, behavioral issues, eczema, irritable bowel syndrome. I inherited a lot of those from my autoimmune adults. And that's when it dawned on me. I was like, these kids are actually showing, these illnesses are actually early signs of autoimmunity. And there is no blood test to diagnose them as autoimmune. But why do they keep happening with autoimmune parents? Right? And I have a child with those. I have two children, and one of my children had spectrum disorder, also diagnosed with possible ADD. One of my children had severe eczema allergy issues. That was horrific. So I saw those patterns in my own children. But to this day, if you actually ask a regular doctor out there, if any of this is autoimmune, they're going to be like, oh, no, it's not. And I'm going to call bullshit on that but it's not out of bad intent. The reason really is that they don't have enough of a population and experience with autoimmunity like I do to be able to say this definitively, that based on my experience, symptoms of autism spectrum, ADD, IBS, severe eczema, allergy, multi-allergy symptoms in children absolutely is part of this autoimmune spectrum that we're talking about. And I am positive that we're talking about in a couple years to come, we're going to see that, oh my gosh, there are autoimmune diseases all along. Okay. So I'm going to tell you that some of these mystery illnesses aren't so mystery. They actually are just part of autoimmune spectrum. And I'm going to name pandas. Pandas is another illness that can affect kids. That's really part of an autoimmune spectrum. I'm going to talk chronic fatigue syndrome is typically, it's not chronic fatigue. It's basically fatigue caused by many different autoimmune diseases is labeled as chronic fatigue syndrome. IBS, irritable bowel syndrome. Most of those people, most of them are dealing with some sort of autoimmune issue going on anyway. Neuropathy. If you have this mystery neuropathy where you have numbness and tingling or weakness and nobody can diagnose what it is, how likely do you think that's autoimmune? Like 100% people. And even if it isn't, the real answer is, can it benefit from a 5 pillars root cause approach to it? And the answer is hell yes, because do you know 30% of people who come into our program don't have a diagnosis? Okay. And if 30% of the people coming into our program, Transform Autoimmune, don't have a diagnosis, but yet every single week I have an interview of an alumni who's getting dramatic improvements and 30% don't even have a diagnosis, this works for any mystery illness because I know it, because 30% of our graduates don't even have a diagnosis and it works. So I'm just kind of showing you from like the trenches on the back end where I'm seeing and dealing with tens of thousands of autoimmune disease patients over the last 14 years, that so many people with mystery symptoms are really being underserved, waiting and hunting for more and more diagnosis. Meanwhile, it's on pause what they're going to do about it. But that disease is not on pause. That autoimmune disease is actually causing more and more damage, many of which is permanent, right? So for me, like, okay, if you want to continue on diagnosis hunt, you can, but please have a mindset shift to really focus on, what can I do to stop it? And the answer really is the 5 pillars approach. So make sure, and I'm gonna talk about this. Make sure anybody with any mystery illness looking for diagnosis is put 5 pillars in the comment, and we'd be happy to send you resources to check out what is a functional approach to any mystery illness awaiting for a diagnosis, because this stuff works. Okay, I'm going to take a quick look at the comments, any questions that you guys have, and then I'm going to wrap it up. And as long as there are questions, I'm going to keep answering. So if there isn't, then I'll be done sooner. All right, everybody. And for those of you, if you are interested already in working with us, I'm going to have a member of my team put up some information on, and I'm going to put that around the bottom of the screen. You can book a chat with us. Okay, so under the screen, you'll see that you can book a chat. If you already know, you're like, I want to work with you guys. I want to really turn this around and stop this now. Go ahead and book a chat with us. The link is there, and you can also check out the comment section. And make sure to check your inbox also later to see if our team has contacted you to give you some resources on the 5 pillars or anything to your comment. Sometimes you'll make a comment and we're like, oh my gosh, we have a perfect guide to actually share with you. We're going to send it to your Facebook Messenger, but you won't see it unless you check the message request. Now, someone just asked, can you help with sarcoidosis? Of course I can help with sarcoidosis. And that's the thing, is so many people are like, can you help with this? 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 I just went through the whole video about how it doesn't even matter what your diagnosis is. If you have a mystery illness, chronic inflammatory disorder, any sort of autoimmune disease already with tons of other mystery symptoms, of course we can help, because literally, like, I love being able to do the 5 pillars approach, especially in an online format. And I mean, it's a topic for another video, but I can tell you right now that I practiced one-on-one medicine for 20 years of my career. And I can tell you that that's not an effective way of dealing with these complex, complicated diseases that require a root cause functional approach. So I 100% dedicate my practice, and my mission is to do it in a group program. And that's how we get crazy ass results, is we do it in a group, small group, with people through our program, with lots of teaching and mentorship and engagement with me and our team. That's the only way to really get these amazing results. One-on-one medicine with this kind of issue that's this complex is very, very challenging and difficult to be able to solve a problem like this. So, which is why we get out of the box approach, because we have an out of the box way of dealing with this, because there's just no way in a clinic setting one-on-one that a doctor is able to educate you the way that I do. With our video modules. There's also no way when people are just one-on-one, they think they're a super special zebra, for them to realize how common these problems and solutions really are among people of every single different type of diagnoses. So any of the alumni in our program are going to know, like if you actually look at the alumni and you look at the number of videos we have, every diagnosis and every symptom on the planet is covered. And this works for it. So of course I can help with sarcoidosis. It's just another autoimmune disease. Rosa says, can you help with chronic urticaria as well? And the answer is going to be, of course, Rosa, we can help, because chronic urticaria is in the spectrum of basically these hyperallergic responses of a messed up hyperreactive immune system. It's an immune disorder. Immune and autoimmune disorders affect many different systems in your body. So of course we can help with chronic urticaria. And in fact, we already currently in our program have like 3 to 4 clients we're working with chronic urticaria. And if some of them even want to comment, any alumni with chronic urticaria that want to comment on the results that they've already experienced can comment in the section below. And those of you who have chronic urticaria, a lot of allergy issues, don't be surprised if my team also messages you with some resources of from our alumni of people who are already recovered from chronic urticaria as well. Angie says, I have body parts withering away. They said I don't have Hashimotos. So she doesn't have Hashimotos, which is only 2 tests, 2 targets out of the 6,000. So she doesn't have a thyroid problem now, right? She says I've tested negative because for Hashimoto's, because I don't have the antibodies, and they are normal, and they're not giving me answers because they don't have any, Angie. I also have empty cell syndrome, and again, no answers. Can you help? Angie, 100% I can help. So book a call with our team. Anybody, I mean, seriously, you can ask me anything right here. I 100% know I can help, Angie. And the kind of problems that you're talking about on a scale of, I mean, and I say this not with like hubris, really from experience. On a scale of 0 to 10, 10 being the hardest problem we deal with in our program, I would put chronic urticaria as a level 3 problem, 3 out of 10 on ease of difficulty to deal with in our program. Angie's talking about feeling like her body is withering away with Hashimoto's and empty cell syndrome. On a scale of 0 to 10 in difficulty, that would be a level 2 problem for me and our program deal with. So I'm just kind of reiterating the point that I think that so many of you, because you're not getting answers, because they're telling you it's in your head, start to think like you're crazy, or that you're some super special rare zebra. I don't know how many comments we get in our feed. I'm a special case. No, you're not really a special case, but I know you think you are. You really just have a pattern that I see in every autoimmune disease, which is that you are just gathering a ton of other symptoms and no diagnoses. And then now you think you're a rare zebra, and you think it's harder and harder to deal with, and you're not. Okay, you just need a root cause 5 pillars approach to dealing with your autoimmunity and many other mystery symptoms. Cam has someone just said, I like this. This must be an alumni. Your healing starts within the first 4 weeks of Transform. Thank you. And yes, she has solutions that are out of the medical realm. Yes, especially being a doctor who really knows all my medical shit. I had to learn all the other functional medicine, natural medicine, that stuff that works. So I love being able to marry the two to offer people hundreds of solutions, not just medication or procedures like I used to when I was a family medicine physician. So Cam says, what's the difference in results between Bootcamp and Transform? So this is a good question because we have multiple programs. We have Bootcamp program. We have My Hormone Masterclass, which is specifically a hormone program. And we have Transform Autoimmune Disease Naturally, our main program. And I can tell you that the main difference is Transform is the kit and caboodle, everything done in 2 months. And it's working with me and my team directly in a community in a live setting. All the interviews that you're seeing is coming out of Transform Autoimmune, our main program. That being said, a lot of people said, I can't afford, I don't have the time or commitment right now to do the main program, but how do I get started? So some people will do Bootcamp. Bootcamp is a do-it-yourself program of things that you can do in the 5 pillars without having to see any other doctor, without having to do any additional testing, is a good place to start. It is not a live program. It is not a community-based program. It's a do-it-yourself on things that you can do in each of the 5 pillars now to get results. So I looked at what was most impactful in each of the pillars and easiest to do without any other commitment to anything else, and that is our Bootcamp program. And if you want information on Bootcamp, my team can post a link in the comment section on Bootcamp, but also just write Bootcamp, and I will have a member of my team message request, send you message to just learn more about you. The other thing is, if you're really thinking about, I don't know which program to join, but I definitely want to work with you, go ahead and click the link to book a call with us, because when you talk with a member of our team live, we actually can get to know more about you, and we can actually discuss what would be the best fit for you, right? So you can click the link to book a chat with our team, and we can troubleshoot which program would be best for you. Thank you. Some of you are already writing Bootcamp. All right. Yeah. And then a member of our team will send you a message, so check your message inbox, and you can learn more about Bootcamp. But again, what I'm going to tell you is that, the root cause 5 pillars approach is very complex. It is a lot of work for us and for you, but it is crazy ass outcomes. Who the hell, like seriously, if your pain goes from 10 to 1 in a matter of 2 months, who the hell can make that happen in a regular doctor setting? They really can't. And so why do we make that happen all the time, every single week, all the time, is because this is a very comprehensive approach. It really covers all the bases of the 5 pillars, and it is working with me and my team directly in a community. And that's our main Transform Autoimmune program. It is the whole kit and caboodle. All right. So that's a big difference between Transform Autoimmune, the main program, and our Bootcamp program. And so that's a topic for another whole other talk. I'm sorry I got into such deep with it, but that was where the questions were going. So I hope that was super helpful for you guys. And I went way longer than I had anticipated, but since you guys had more questions, I decided to stay. I would love if you can share with me what your biggest aha was. If you can tell me based on this, because I answered some questions about why is a diagnosis so difficult in dealing with autoimmunity or multiple mystery illness syndrome. Why is a diagnosis so difficult? The second question I said is, do you even really need a diagnosis to do something about this? I even talked about what's the mindset shift that it really takes to go from waiting and waiting and waiting and begging to actually stopping the whole process now. And I went over the bonus section of what are some symptoms and diagnoses that I already know is autoimmune, that currently we don't have the testing for it, that is frequently people are being wrongly told, but the doctors don't know better, that are autoimmune related. So those are all the topics that I covered today, which is a shit ton, all right? And I would love if you can tell me what the aha is that you have here. And Lisa says, thank you. Trinity says, thank you so much, Maggie. You're truly amazing. I appreciate it. Thank you for your comments, Trinity. Appreciate your feedback. Merritt says, mindset shift was such a key to success. Yeah, I didn't even mention all the mindset work we do in our program. Changing how you think is the most important step. And if you got nothing out of the video today except to change your mindset from diagnoses to what my diagnosis is to what can I do right now to stop this shit, regardless of my diagnosis. And the diagnosis doesn't even matter. If you can get to that mindset, this is when you're going to get results. I can tell you that. If you got nothing else, I hope you got that from me. And then Cam says, thank you. Confirm that the diagnosis isn't the end all be all. I don't really want to start medication with minimal results. Cam, I totally hear you. Book a call with our team. Nicola says, can't wait to talk to you. We are looking forward to talking to you, Nicola, as well, and to learn more about you. These are absolutely solvable problems. Like when people say, I have mystery illness, or my doctor don't know what to do with me. I know that you guys think that I'm stumped, but I literally am like, no, I'm kidding. But really, my bread and butter and our team's bread and butter is mystery illness and no diagnoses or multiple autoimmune diseases. I laugh at danger. I really do. And because we have the solution, right? All right, everybody. Thank you so much. I hope that was helpful. And if you love these autoimmune table talks, I would love, if you have a topic that you would love me to cover in future autoimmune table talks, go ahead and put it in the comment section because I really do read every one of these comments and they'll help me figure out decide what to do next week in my autoimmune table talk. And then definitely. And then everybody, thank you so much. And again, you just watch this. If you know somebody could benefit from it, comment in this comment section with their name so that they get to see this later. All right, everybody, have a great day.